There's only a few questions on the test that are the 3 answer questions, but those are like so much easier than the 4 answer questions. What are y'all's questions before I continue?
Before they ask questions, can we back it all the way up, Brittany? Because
Yeah.
one of the things that I feel people that I'm trying to do a better job at is once we finish, when you do your presentation that night and I send you your supervision verification form, can you back it all the way to what happens okay? All right. Good.
Yes. I was so impressed with how easy that was because I got scared. I thought I was going to have to submit all these proofs and stuff. Um, that verification form, I just submitted it to the board. I think I had to pay a fee too. Um, so yeah, you pay the fee and then you submit your verification form. And I want to say it was like a week or 2 weeks later, I got an email that I had been approved to take the exam with a code. And then the hardest part was finding the code and then going to the test website and getting the website to accept your code. After you get your code, you have to wait like 24 hours to look yourself up on the test website. And then you have to pay the exam fee before you could even see the available test dates. Which I found this test was a lot more limited on spots than the master's exam. Like, I think like there was like a 2 week, I couldn't just sign up and take it that weekend. There was like a 2 weeks of no test dates available, and it's very limited on the dates. I wanted a Saturday. It was like 2 months before there was a Saturday available, but a lot of people, I guess, back out last minute. So if you look and keep updating, a spot will open up.
And Brittany, I want to also speak because Brittany's in South Carolina. I don't know the last time you've been in Alabama, actually, but she's in South Carolina. And I think one of her concerns when we were walking her through was she thought she was going to have to come all the way back to Alabama. Do you want to speak to that?
Yes, I was so panicked about how I was going to drive the 6 hours back to Montgomery and take my test at 10 a.m. You could take it at any testing center. So you just type in your zip code, and it doesn't matter if you're out of state or whatever. You just take it anywhere you want. So I got to take it here, which was so much more convenient than driving back to Alabama. And it's all the same price everywhere. And so yeah, you just gotta make sure you got your right IDs with you. You need like a state ID, and then like a backup ID. I just took my LMSW like master's license and my driver's license, and then you just show up, and it's all good. There were some changes in the actual testing center that they'll go over with you. You don't have to like raise your hand and wait for them to go to you before you can go to the bathroom or anything. You just go, and there's nobody in the room with you. They're like outside of the room watching on the camera, which was different. But yeah, I that experience was fairly easy and it was very quick. I've heard some states they take a long time to approve that, but Alabama is pretty quick about everything. So, and then after I took the test, like a couple days later, it showed up on the website. I got a new license number and everything. Yeah, it's very quick. Um, what other questions are
I had a question. You said that I had two questions, so I'll start the first one. So the testing center, since it's the new people that are testing, so do you like, as far as can you like leave to go eat? I mean, like have food in your locker or something like that? Did they give you lockers? And were you when you said by yourself, was there people in the room testing, or you just in a room by yourself?
Yeah, there were several people in the room testing with me. I actually had to use the headphones. They have like these noise silencer headphones because a lot of people were just like making different sounds and it was very distracting. Um, for the locker, they don't have you put your stuff in a separate room in a locker anymore. You have to show them that you power your phone off and they give you this bag and they lock it with their key and then you take it with you and you hang it on the back of your chair. I didn't take any food with me. I know that was an issue I had last time because I was pregnant. This time I did not have that issue, but there was a girl there who was diabetic, and she was like, I'm diabetic, I need my food. And they didn't give her any problems. They just told her that you can't pause the test. And if you needed to eat, you have to take it outside and like have it um, out there in front of them, and then you can go back in. But yeah, that was that.
Oh, and my second question was, you said that like the test, I know like the LMS test, everyone was saying like, don't use your personal experience, like, because that was tripping some people up in some forums, but you mentioned that like you did use your personal experience, you felt that helped you. Could you explain that?
Yeah, I felt like it helped me to put myself, like, there were a lot of questions on this exam that were like putting you in the role of a therapist, and you have a client with a certain mental illness or a certain situation, and then how would you help them? What would you do first? Like, would you validate them, or do the treatment plan, or whatever the question was about? And it helped me to consider, like, okay, well, this question says I'm meeting this client for the first time, and this is our first session together. So and that was how I was able to sit and like, well, what have I done the first time meeting with a client? Where with like the master's test, I feel like the questions weren't really like that because you're kind of just getting out of school, or you don't have any experience working in the actual field, like with a license. So a lot of those questions, they have the acronyms, that were like the safety first and I forget what they were, but it was really easy on that test to just look at the acronyms and say, like, I can pick out this answers. That one fits the acronym perfectly. I'm going to select and it's going to be the right answer. And with this test, none of the acronyms really apply. It's kind of all based off of your judgment, and just considering what I would do. That helped me a lot. I would say I got lucky because there were a lot of questions on borderline personality disorder. I think every diagnosis question I had was on that one, and then there was a lot of hospital case management questions as well. So I have experience with both of those things, so I knew what to put for those. So that did help a lot, I think. Yeah. And there was somebody else who had a question too, right?
Me, Brittany.
Yeah.
I put my hand down as well because the second question I had you answered, well, you touched on the answer because I was going to ask, I know you had experience in the hospital setting in social work, and I was going to ask you if that actually helped you with the test and how so, which, like you said, it did. But if you could elaborate more on the lines of that, because I feel like in the prison setting, learning different diagnoses and different therapeutic techniques to address those, just to see if that was something that was addressed on the test.
Yes. I had a couple of questions that were like, you have a client who's being referred to you with a diagnosis of borderline personality disorder. What therapeutic model might you consider using when treatment planning? And it's DBT was an option for that, so that one was really easy. I actually had a question that was like, you're working in a hospital case management position and you get a referral from a doctor stating that there's a patient who with a terminal illness who's not willing to sign a DNR, and they would like for you to go see them and educate them on what a DNR is. And that was like what is a self-determination question. It was like you just educate them and then expect their right to make their own decision. But there were some answer choices that were like, have the man sign the DNR, or get with the doctor and planning on how to get the man to sign the DNR, where those questions, I think a lot of the questions on this test are remembering self-determination, and like people can choose whatever they want to if they're in their right mind. And also considering like hospital experience, there were some questions on like patients with dementia and making their decisions. And it's like, you need to find like a POA or somebody who can assist them. So I think that hospital experience helped there too.
And I have one more question. You know, on the MSW level, once we apply for the test, we receive a letter, and it's good for a year. Is it like the same on this level? Would it be that? Because I know you would talk about scheduling and you waited a little while, so I just wanted to know about that.
Yes, you have a year to take it, and they give you the like your approval expiration date before you. And I guess after that year, you just pay the fee again and resubmit your stuff.
I do want to jump in here. No,
Okay.
I don't know. And y'all, I always encourage y'all to look at Alabama law. I can't remember what it is, but supervision hours do expire, I think, after 3 years. So you do continue to get a year. You can renew that approval letter. But no, I think that they'll make you redo supervision after a certain amount of time. Don't quote me on 3 years, because I've had one that was way back that she got approved. So, but I don't remember when we were in supervision together. But we were concerned that her supervision hours would have expired. And then the other thing I just want to throw in there with that is within that year, you can take the exam 3 times. So if you're trying to stay within the approval window for that 1 year, if you take it, you have to, I think, wait 90 days, and you can take it again, just like your MSW. But also I have one who didn't pass this recently, and she got hers waived. So you are able to even waive that 90 days if you need to. But I really want to tell you guys, don't give up on yourself. I had one who took it 3 times and she passed it. So, you know, don't give up on yourself. Just keep taking it, even though it costs money. Brittany, do you remember, was it $75 or $100?
I believe it was 75.
75.
Yes.
So I wanted to speak to that too. No, a $75 fee to the board, right? To apply. So when we're talking about the supervision verification form that I give you guys, that's the clinical license application. So you're still doing the application just like you did the LMSW. I'm just adding your supervision verification form to that. And you pay the $75, and then you pay $260. Isn't it $260 now, Brittany, for the clinical exam?
Yeah, it was like 260 or 265. Yeah, I was surprised about that. And that's very, like, a lot of anxiety, I think, is added with how expensive the test is, not wanting to pay that again. Yeah. I see I have 2 hands up. I think Gabrielle Henderson raised her hand first.
Yes, I know Renita just spoke on being able to get the test waived if you had to take it again. Is that because possibly the score was high enough, like maybe you missed it by like a certain amount of points, that they will allow you to waive it? Like, what's the...
I'm not sure about that, Gabrielle. And it's the time is waived. The 90-day time
The 90
is
days.
waived. Yeah. And I'm not quite sure, but I think I remember hearing something like that, that it was within 5 points, you can waive the 90 days.
I think so.
And so if someone in our community wants to look that up and find out what the days are, or the points are, I think that would be great. I know Teresa also has her hand up, but I also, Brittany, wanted to, because I love that you have hospital case management, but I have also, I know what I wanted to say. There's 2 things I want to say. Y'all still do the whole broad, you know, because you never know, you just don't know what's going to be on the test, because a lot of my folks have had a lot of community questions on their exam, right? And sometimes we don't think and talk about the community. But then the other thing, I love, Brittany, that you said, because what I wrote down was the LCSW test is more critical thinking than it is recall. And so if you're a really good critical thinker, and or you can practice critical thinking in areas of your life, I think that's what Brittany is basically trying to say. that's why I was a little, because Brittany's an amazing critical thinker. It was probably easier than recalling with the LMSW to do the critical thinking. And that's why, Krista, when you said some people are saying not to pay attention to your own personal experience, if you're a critical thinker in your personal experience, be a critical thinker within the clinical exam. Is that what you were basically saying, Brittany? It was more critical thinking than recall?
Yes, I guess my strategy kind of that I used was, if I were in this scenario, which one of these answer choices would I be most likely to use? That really helped me. And I even like played out, well, what could be the possible result of doing that option? Does it address what the question is asking, or does it address something that could be handled later? Almost all the answer choices are something that you would do, but it's like, which one is the most important to start with? And then some questions are like, none of these answer choices are what I would do, but I guess which one is the best one to do? Um, I'll say that, yeah, the critical thinking. Because with the master's exam, I really think that having those acronyms, so like the ones that are like the steps of what you would do first, it was really easy to read those questions and look at the answers and say, well, this one is clearly what I would do first. Or if it's a safety issue, obviously it's like address the safety concern first. But with this test, every single answer might be something to address safety, so it's like which one is going to be the most beneficial, or like the most like, I guess, like science backed like response to addressing the safety. What's the most clinical answer? Does that I can't think of the word that I'm thinking of. But yes. And then Teresa, what is your question?
Hey, Brittany, thank you for doing this.
Yeah,
Whenever
of course.
I was studying for the MSW, I used like the Therapist Development Center, RayTube, Savvy Social Worker, Pocket Prep, like all the things. Is there any other supplemental materials that you use to study besides using RayTube?
Well, so for both of the tests that I've taken, I just did the test that's on like the ASW website. I think it's
Yeah.
$85. And I truly think that is the best, because I've not like purchased other things, but I have looked over things. And I just think that the questions on the practice exam from the website is absolutely the most like the test. Some of those questions are retired test questions from the actual test. So it's the most like it. And I think it is a little bit harder. So if
Yeah.
you can pass it, and then I reread through the whole test twice, and like I could remember like word from word what the question was and the answers. So when I took the test and I had similar questions, I was like, well, what was the answer on the practice test to this question? And which answer is the most like that from the practice test? So I think that that's the most beneficial. The RayTube is just nice because you don't have to read anything. You can listen to it. I listen to those videos while I'm like doing my makeup or in the car, and it's just a way to stay focused and stuff. So that's the only other thing that I used. There are some people who like have really great memories on like Reddit that are like, this is the exact question from my test. What answer would y'all have put for this? And it was kind of helpful to read through those and kind of see what people were saying if you want to get some more input. But yeah, that's what I used.
Can
Thank
I
you.
speak to that, the ASWB exam? So if you didn't do it in your LMSW, know that the only way you even get access to it is after you get that code from the board.
Mhm.
After you get that code and you are a registered test, you've registered to take the test, you get a 30-day window. So I love that Brittany said that they won't let you take it that next weekend. I say take those 30 days, because you only have access to that test for 30 days. And Brittany, though, y'all, she's not telling y'all, she has a photographic memory. So some of us who don't have photographic memories may not be able to remember exactly what the test, but I would access that test daily for those 30 days. instead of trying to take it 2 weeks after you get access to that. And I totally, completely agree with Brittany. The ASWB exam is the best one out there. And it used to be 65, then it's 75, and now I hear Brittany saying it's $85. But it's absolutely worth the $85. So again, I want to, especially those who are going to be graduating soon, Mary, for Christmas, we're paying $75, we're paying $260, and then we're paying $85. So we're talking close to $400. So ask family members for money for your birthday and for Christmas, because it does get costly, but I want you guys to be as well prepared as possible, including, because like Brittany's saying, paying that much money can cause you anxiety. And so knowing that you're paying close to $400 without even getting some of these other test prep materials, have your family support you by Cash Apping you. Okay. I'm sorry. I just want to keep jumping in when.
Yes, that's good. I will say also, I didn't want to like spend my money on the other things because it's like the exact same. You get all the questions. I mean, the practice exam is the same amount of questions as the actual exam, and you get like the 4 hours to take it. So, I mean, that's like, what is it, 175 questions? And there's only so many ways that you could word those questions. So I think just get that, kind of take your time taking it. And when you do take it and you submit it, you can't take it again. And they like highlight the answer that is correct and underline the answer that you put. So it's really hard to like, they used to just, you could just cover the A, B, C, or D and try to take it again from memory. But now it's obvious. But it comes with, after you take it, there's like a paragraph after every question that explains why the answer is right. And it's really good because it would be like, this choice is good, but not necessary right now. And this is something you could do in the future, but why would you do this first? And it's just, I liked the way that it was just so spot on. There were even some questions that were like, there's no reason to put any other answer than A. so I like that test. Yeah. And Krisha.
Hey,
Hello.
so how soon did you start studying? Because I was thinking, so I'll be done next March. So I was thinking, like, would it be okay, like, to study like 3 months? Like, say I'll be done in March, start studying in January. So once I'm done, I can go ahead and take the test. Do you think that would be like a good idea, or to start studying once you complete the hours?
Well, for me at first, I was kind of just like, I was very familiar with like the code of ethics because I've had to read it so many times for different jobs and stuff. So I was very familiar with it. And I think that's one of the most important things because it tells you what to do in different scenarios, like flat out. And I like rules. So I was like, I'm not going to study for the test. I'm just going to take my acronyms and just have those. But then I read a post of somebody saying like the acronyms are absolutely nothing for this test. So I just did, I mean, I think I had about a month from the time that I took the practice exam and completed it till I took the test. And I wasn't like studying every single day, but when I was in the car, I would play a couple of questions until I found that I wasn't able to pay attention anymore. And then really that week, like leading up to the test, was when I was like, I'm going to read over these questions like every single night to keep it on my mind. But it's like hard to know exactly what to study, or actually I'll tell you exactly what to study. There are at least like 3 questions on the test that are going to be about medications. So it's like, you have a client with schizophrenia, what medication would you expect them to be taking? And it might be the generic name or like the regular name. So be familiar with those. And I know RayTube has a video where he could tell you like the last part of the drug name tells you what the drug is for. So it's really easy to remember those if you could like know like the PRAM goes with like anxiety or whatever. that'll be helpful. And if you can remember those, then that's like at least 3 questions on the test that you could get right. So that's a good strategy. And then the time frames of giving a diagnosis. So there is a question on the test that's like that I had that was also in the practice test that was on the RayTube videos was like somebody witnessed a car accident. What, and then it's like 3 weeks later and they're showing signs, and then it'll list the symptoms. What is the diagnosis? And it'll be acute stress disorder, post-traumatic stress disorder, and then that like, oh, I can never pronounce it, but it's like polythymic or something disorder. And they're all extremely similar symptoms, but they have different time frames. So it's just important to know when you would diagnose PTSD versus acute stress disorder. And then bipolar disorder is a big one, knowing the difference between bipolar disorder and just depression. There are some questions where it'll talk intensely about somebody being majorly depressed and suicidal and in the hospital, and it'll be like depression, but they'll really word it like you want to immediately think bipolar disorder. And there are a lot of other conditions that you can look that have similar symptoms to bipolar disorder, but different time frames. So just know your time frames. And then borderline personality disorder versus other personality disorders. I had like 4 questions on personality disorders and knowing the difference. And for those, it was always like, it would give you a case example of like, they were all girls and they were all like young girls. And it would just describe their symptoms, and then it would be like borderline personality disorder, histrionic, and I hate seeing those together. I feel like they're all so similar. And then they would throw in like a medical condition too. So it would just know the difference, because usually those questions they would have in there like they've already been to the doctor and had their thyroid check, or like they haven't seen the doctor. So that's a good way. I think RayTube, he's got a long video on knowing when to refer somebody to the doctor to get their health checked before making a diagnosis versus making the diagnosis, because there are some conditions in women that could represent a health problem. And I did have a test question and a practice question like that. So just be familiar with the time frames and then those conditions that can really seem similar because they were on there. The hardest questions, and I think the ones that I missed, I meant to say this when Renita said it earlier, the community questions. I feel like those were definitely the ones that I missed, because I had questions that were like, you've been in charge as the director of a new community organization. What are you going to do first? And it would tell you like what your organization is for, and then the steps. I didn't even know which one to pick. It was like do a community study to see what the needs are, and then meet with the population, request funding from the city. All of the answers seemed correct, and I was like, where do I even begin? I guess a community needs assessment, but so know what to do there, because those can be hard. And then I had some that were like, you've been set as the manager of an organization, and you've been tasked with coming up with a training program for new staff. What would be helpful to have them start from on their one-day training? And it was like a video on the organization's history, and I just feel like those questions, I don't know your community stuff and how to help organizations. Does that make sense, Renita?
It does. And, thank you for that, for one, as the supervisor. Good that I have, because no one's given me that specific. That's your beautiful. I I just said it, you can remember everything. I love that your brain works like this so that I know specifically what is happening. But I also want to say, because y'all are not that far from graduating. If you have your community book, I hope you didn't sell it already. Please pull it out, because I think that would be helpful as well too. A lot of people want to do macro social work. They don't realize how important that particular book is. So if you still have your community book or you have access to one, I think that would be good for you to see what those steps are that they're talking about. I do want to say, especially since we have some new faces, there's 3 things I always tell social workers to have, especially as you're going into your clinical exam. Have the pill book. It's mine's in the room. Have your pill book. It's like less than $10 on Amazon. I think it's in its 16th edition. And it will tell you which pills are used for mood disorders. And that's usually the questions they're asking. Mood disorders. Y'all know there's no medication for personality disorders, but it will tell you what drugs and the generic name. And even if you have RayTube, I think as clinical social workers, you need to have the pill book on your desk. Mine's not on my desk, but it's in my room. So have your pill book. That's what it's called, the pill book. The second thing is I always tell you guys, and I love that Brittany through supervision, she is right about, she has always read her code of ethics. I used to read my code of ethics like it was my Bible. I would have my Psalms and I would have my code of ethics. Read your code of ethics daily if you're able to, right? Even if you don't have a scenario going on in your life, and don't just stick with one client's responsibility, our social worker's responsibility to clients. Make sure you're going into 5 to our responsibility to the broader society and to the profession and to number 5 and 6, because those are going to be the questions. And when you go to the ASWB website, it's going to tell you like 28% of the exam is HBSC, 18% of the exam is assessment and clinical, but a big portion of the exam is the ethics, right? So make sure you're reading the code of ethics every single day, especially, Lucretia, I heard you're graduating in about, I would say, yes, start at the end, as soon as holidays are over, go ahead and start. Do it now. I listen to podcasts, like Brittany is saying. I listen to podcasts every day about cluster B personality disorders. I listen to podcasts about medication. Just go ahead and have that, be a lifelong learner. The third thing I always tell people to have is the DSM, whatever edition we're in. So there's 3 things you got to have: the pill book, code of ethics, and you can buy that off the NASW website if you want the actual, and it's like less than $10 as well. The code of ethics and your DSM, whatever edition we're in. I think now we're in DSM 5TR, and you can get used copies of the DSM 5, and that still would be okay, I think. And you can just read about what changes the TR brought, so that if you're not wanting to spend the $100 for the newest edition, you can get the last edition for $30, right? And just look at what the changes are. So those are the 3 things that I suggest: the pill book, the code of ethics, and the DSM, whatever edition they're in when you take your exam. Okay? Brittany, what else you got for us, babe?
Yes. The new DSM stuff, that is very important. When I was taking the practice test, there were some things on there that I was like, I got to get my phone and look up what this is, because I have no idea what they're talking about. And looking it up, and I found it was like new DSM stuff. So they are like testing those questions in there. So know that. And yeah, I mean, my biggest challenge is the personality disorders, and I know that. I just can't get it. So that was what I spent the majority of my focus on, like reading case examples and listening to people's stories on that and reading the DSM. So that's my challenge. And I just knew that my test was going to be mostly personality disorders. I don't even feel like it's right that every single diagnosis question I had was about a personality disorder. There's so many other things out there, but
You manifested that, babe. You manifested.
That's what I had. And I was like, okay, I've already answered borderline personality 3 times, so I got to pick another one because it can't be the 4th time. But yes, like just one of the questions I had was like, you're at a meeting and the doctors and nurse practitioners keep over speaking the nurses, and you could tell the nurses are getting frustrated. What are you gonna do first? And one of the answers was like, report what you've been seeing so that people can be aware of it. And then there was one that was like, talk with the nurses after the meeting to teach them ways to speak up for themselves. And one of the answers was, tell the doctors and nurse practitioners what you saw privately so they can correct their behaviors. I was like, oh my goodness. Like, what would what? There's like these questions that was a really like an intense one. So, yeah, I think when you take the practice test, it'll give you your breakdown at the end, and it'll show you like you missed how many ethics questions, how many community questions, how many diagnosis questions, or whatever those are grouped into. And it'll tell you like your strong suits. So I didn't miss any of the ethics ones, but I missed all of the community ones. So I knew I had to focus on that. So that'll tell you where you're at. If you take that when you finish supervision, that'll show you how ready you are and what you need to focus on, which I think it's helpful to just take that test and see where you are. What other questions are there?
Yeah,
Did
I
you,
can't believe you don't have a question. You always have a question. But go ahead, Kristen.
I had a question about RayTube because when I was studying for my LM, I tried not to put a bunch of, everyone kept saying you can get overwhelmed with the studying. And the one thing about him, I didn't know that he had like a YouTube, because I found it to be a bit chaotic. And with my brain, I kind of like organized, kind of like structured way to study so that I kind of have an idea of where I'm going. And so like my question was, you said that you just, like, I used TDC when I took my LM, and I didn't want to pay for it, but I wanted I didn't want to pay for it, but I did. But like did you have any kind of like study guides or anything? Or like is there a book, like the big book from Dawn, somebody, I forget. Is there one for like LC? Did you use anything, or you just did your memory?
I just did it that way. Me personally, when because I purchased a book that came with an app for my master's test, and I found that I got super, I guess, frustrated with how expensive it was while I was studying. I couldn't really focus. I was like judging the questions too hard because it didn't come from the board. So I was like, well, how do they know? And it wasn't like backed by the people who made the test. So I was like, I would rather just get it directly from them. And I think I just myself spent way too much time focused on how costly it was. So just having the practice test, and that was, my attention span is so bad since I have kids now. You get 4 hours to take it, but it took me like 4 days to finish it. So I felt like reading back through those questions, I would have 20 questions, but it would take me 2 hours to read back through those questions and really understand, because I would read the response that it gave me on why I got the answer wrong, but then I would have to look it up and look at my DSM about really what that diagnosis meant, or go to the code of ethics and reread that part about the code, or if it was a community question, I had to do a lot of reading because those just kind of go over my head. So I found that was plenty enough for me, and it told me exactly where I was, because I think you could miss so many questions. You have to get over 100 questions correctly. And when I took the practice test, I got 108 questions correctly. So it told me that I knew the answers, but I was so close to almost not passing the practice test. I just focused all my time on that. and it really mirrored the exact test so correctly. And that's 175 questions. But if you need more, then I think I know like Ariel, she passed her test and she used like so many different books and study guides to pass hers. And she shared one of them with me, and I looked through it. And I partially took one of the practice tests, but I was just having trouble like reading those questions. They were extremely hard, like way harder than the practice test. So yeah. I hope that I know that was a really chaotic answer. I'm sorry.
No, that answered a lot because like that book, Donna Abcar, like I had gotten that book and her test questions was like ridiculous in the back of the book. So I did purchase the ASW for the ASW, and I thought that was extremely helpful because it helped me see how the layout of the test was. It made me feel a lot more comfortable, and I passed that. So I felt good, so I just went. So I plan on purchasing that again.
Yeah, because you don't want the questions to be like way too hard, because then I got really discouraged. I took some of those practice questions that I got from my friend. They were extremely hard. I remembered them and they were helpful, but they brought me down, like taking them, and gave me more anxiety than what it was worth. And for me, the time, I take a long time to read questions, and I think with these questions, they do take a long time to read because they're long, and you do have to highlight to get exactly what they're asking you. So the time, like having 4 hours, I finished with like 10 minutes to go. So that was something that created a lot of anxiety for me. Like the biggest thing was just how long the questions are. I was reading some of them like 5 times, and just how they're worded. Some of the questions you really only need the last sentence because there's just a whole lot of extra stuff in there. So yeah.
That was a good answer. Thank you.
Yeah, of course.
So I got a question. So what self-care did you do before your test?
Oh, well, it's funny that you asked that. So I love coffee, and I love like a lot of sugary, sweet coffee. So I made sure to get the time to go to Dunkin' Donuts before my test. And then I peed like 7 times during the test. But the coffee was the biggest thing for me. Even though I get coffee every day, it was just really important that I got enough time to get that. And then the day before my test, I didn't do any studying the day before. You're most likely going to remember things when you study, not the day before, but the day prior to that, before you go to bed, and then sleep on it. And then that's just the way that studying works. So that day prior, I just rested, and I did my work, and I did my hair. So my hair was nice. And then, yes, then I went to take the test, and I was fine. I didn't tell anybody that I was going to go take the test. I just said I had somewhere to go and look at my location if there's an emergency, because I didn't want anybody to know, because I felt a lot of pressure, from telling people. So yeah, that was what I did.
Brittany, I'm so glad you brought that up because Brittany and I actually talked. She is in South Carolina, like we said, and she's at a hospice. And she had told her director that she was taking the exam. The director or somebody announced it at the employee meeting, or yeah. And I was like, girl, if you don't reschedule that test and don't tell anybody, and I'm telling not even me, y'all, just let me be surprised with the rest of us that you passed it, right? Don't tell anyone because it's external pressure that you put on yourself that, oh Lord, now I'm gonna have to go tell these people whatever, right? So don't tell anyone. And I tell people, don't even tell me, because I know even if I don't mean to be, sometimes if people are, I gotta tell Renita, yes, tell me, I want to know. Let's talk it through, but don't even tell me so you don't have that kind of pressure on you. So because I wrote that down, Brittany. I was like, tell them a story about how you had to.
Yeah.
Yes.
That was horrible. Yes, I was at a work meeting, and I work with another social worker who I don't like, everybody's different. and everybody comes from like different backgrounds. So she was kind of doing some things that were like a little crazy. And I was like, what is up with this girl? And she like wasn't in any type of supervision. So I asked my boss if they offer any type of like supervision, and she's like, what the heck is that? I was like, well, it's required by the state that like people who are practicing in the field, they need to be in some type of supervision, even if they're not going to take the test. They just need that. And she got all confused and then thought that I couldn't be working there because I wasn't in supervision. And then she announced to everybody that I was going to be taking my test so they could reach out to me after I take my test for questions. And I was like, oh my gosh. But she's just a little crazy and she forgot about it the next day. So she didn't bother me again. But yeah, that was scary. That was very scary. I didn't want like my job to be dependent on it because I felt like that would create a lot of anxiety. I just didn't want anybody to know.
And Brittany, last little bit, I think who was asked this, and such a Alexis. I know they're not using Pearson anymore. So Alexis asked, are they still using Pearson? So can you talk about the new company they're using?
Oh yeah, it was very similar. I didn't even notice that it was different. That's like the actual people that like the computer program that you use. So I was familiar with it because it's the same setup on the practice test, and I got a little frustrated because you know how when you take the test, it wants to give you practice of like how to click A, B, C, or D, and how to highlight and how to underline. That process was like 20 minutes. And I kept getting so frustrated because you can't just like click through it all. You got to sit there and do it. But the test was very, it was easy to take. The highlighting is nice. The flagging was very nice. I flagged every question that I was unsure if I got it right. And then I could kind of keep up with like, I'm doing good. And that made me feel good. At the end, when you finish taking the test, I liked before, like you finish and it pops up with like you passed or whatever. This one, it doesn't do that. You have to do 3 different reviews of the test. And they're like 10 little things, which took way too long. And then after that, it takes forever to load and tell you. And it's not like obvious at the top that you passed. It's like at the bottom. So that was a little stressful because I felt like my eyes were jumping and I couldn't read anymore after that. It's too much time. So yeah.
Brittany, I'm so super proud of you. You passed on the first try, darling. I'm just so super proud of you. I'm regardless if you passed on the first try, not all of you guys. I'm proud of you for being in supervision. Proud of you for not giving up on yourself, for betting on yourself, to just be able to live a better quality of life for yourself and for your family. Because I guess in the last 2 minutes, Brittany, have you, I know it's only been a month, but are you able to see, because I talk about it all the time, Tamika messages me and I don't know if y'all remember Catherine. I had a coffee date with Catherine, who's an LC, she was in supervision, and now she's in Idaho as an LCSW. She was visiting and had a coffee date with her this morning. I have like an army of LCSWs behind. I'm just loving this shit. But have you been able to see the doors that are opening up for you as a clinical social worker yet?
Yes, I have. Especially like at my work, I've been like able to make just decisions, and I'm like, this is the decision I'm making based off my clinical judgment. And I've noticed like that has changed. I feel like I get a little bit more respect. Nobody here knows like the company that I work for what a social worker is, but they know I passed another test and that's helpful. I'm in the process of switching my license to South Carolina. But there are a ton of therapy jobs open here. I see plenty of posts. So I'm excited to hopefully kind of switch into one of those roles. So yeah, I definitely have. I think the jobs have opened up. There's new things. You don't have to kind of stick to like hospital or home health company to actually get some type of good pay or prison or anything like that. So yeah.
So y'all, it is so worth this clinical supervision journey. So keep showing up, even when you're like almost there and you're like, oh my God, I'm so over it. Keep showing up. And I just want to also, because I have not done a good job of this, but because Brittany is here, y'all, I'm in private practice if you didn't know. Just by the way, I'm in private and I go, two of the platforms that I use are Alma and Headway. So Brittany, when you're ready, let me send you my referral links because I have not done a good job of sending y'all my referral link. I'm licensed in Idaho. I was just talking to Catherine today. It's $167 a session. Right. So look at, in Colorado was easy to get licensed in, and that has a really great reimbursement rate as well. So when y'all are ready, let me send you my Psychology Today, my Alma, and my Headway links so that I can help you get, I won't help you get, they'll help you get started, but at least you'll have platforms that you know are reputable, that pay you on time and give you really good. Because when I went into private practice, I was in one of these platforms that was giving me $60 a session. Did I mention the Idaho reimbursement is $167 a session? All right, so let me give you the links to the places that are reputable and are reimbursing and are valuing social workers, so that you're not out there in this wild west of private practice. Okay.
We need to talk about that. Yeah, that's a big difference than what I see on the post.
It's a huge difference. It really, and then you become bitter because you're like, oh my God, how did I not know? So I
It's
don't want you,
illegal.
the whole point of us doing this is for y'all not, I already made the mistakes for y'all, so I don't have to make them. You can just go and be great and go into your 6-figure life so that you don't have to make those same mistakes. Mary, what you cooking?
Red beans and rice.
Oh, that's my Mobile baby right there. She's got that Cajun food. All right, Brittany is gonna be back on the 10th. She's coming on the 7th. Some of y'all are in the 2-hour supervision, but she's taking over supervision again on the 10th to talk about being licensed in multiple states, specifically New York, because I've had a few people who are really interested in being licensed in New York, and she is licensed in New York. So she's going to talk to us about some of that because I'm not licensed in New York. So I defer to the expert. So if y'all are interested in that and you haven't signed up for that one, y'all see she's an amazing teacher with a lot of great information. So we are excited to have you back on the 10th as well, Brittany. Thank you for coming and sharing your experience with us.
Of course. Thank y'all. If you have any more questions, just let me know.
We will, definitely. All right. Bye, y'all.
Bye.